Greetings from Citizen Health and the Team Academy IAPSME Connect. And today, in the series of People's Health It Matters, we have Dr. Satabdi Mitra, who is Assistant Professor in Community Medicine, KPC Medical College and Hospital, Kolkata, Bengal. A very warm welcome to you, ma'am, on behalf of all the audience.
Thank you having the for the great opportunity.
Thank you, ma'am. And again, we are going to talk on a very interesting and serious topic, which we have talked earlier also, but today we will talk in a different angle for the geriatric people, and as we can say that for the elderly people. So, my first question will be to you, ma'am, that why geriatric age group people are special? Why do you feel that these age group peoples are the major concern of the society and we need to talk about them?
Well, actually, the geriatrics that deal with the study of the diseases and treatment of the old age, and it is mainly concerned with their physiological and psychological changes. We all know that aging is a normal biological phenomenon, though it is inevitable. And it is exactly not known when the old age begins. In 1980, United Nations considers that 60 years of age should be considered as the transition to the old age, and it is also followed in India. With the advancement of the health science technology, there is increase in the human longevity, which has resulted in the huge number of the people living in the elderly age group or the geriatric age group all over India, including the all over the world, including the developing country like India. In 2021, there are 10.1% of the geriatric age group people in world, according to the World Health Organization. And among them, more than two-thirds, 66%, live in the vulnerable situation, having the food insecurity and insecurity in terms of the healthcare services. Majority of them, especially those who were involved lifelong in the unorganized sector, those who were unemployed or were unemployed for a long period in their lifetime, in their productive lifetime, or with the unskilled labor, they face the major problem because they don't have so much store of the money and no or little access to the health security benefits. So they have to be economically dependent on their children. It is always obvious that people are not afraid of dying. They are afraid of being dependent. So this age group is so much important.
Okay, ma'am. So, in your concern, what are the major health and allied problems faced by elderly?
Uh, Besides the common general problems, for the elderly, there are some special physiological, psychological, social, and pathological problems. Physiological, like as there are the cataract, glaucoma, deafness, some bony changes like the osteoarthritis that may affect the mobility. There are some changes of the physical and mental outlook. There is a graying of the hair, falling of the teeth, skin wrinkles appear, and these people, that is elderly age group, people become more prone towards the injuries, fall, and acquiring infection. Psychological problems like as there are the senile dementia, forgetfulness. There is slowness of activities, intellectual performance become very low. They feel of the isolated. Sometimes depression become very much common among these people, which even may lead to the suicide. Like the social problems, besides the huge poverty, because of the crunching of the monetary sources, there are some maladjustment with the younger generation. Sometimes out of these problems, they acquire the unhealthy lifestyles, like the smoking, alcoholism. There is idleness, boredom. These social problems are very common among this age group. And regarding the pathological problems, like the systematic diseases affecting heart, blood vessels, respiratory system, genitourinary gastrointestinal system, neurological problems. There are more occurrences of the hypertension, diabetes, various forms of the cancers, and other non-communicable chronic diseases. There is chronic energy deficiency, diseases of the eye, bones, joints, like as I mentioned, osteoarthritis, osteoporosis. These are very common among these age group peoples.
So, how to address these issues?
Yes, addressing these issues and going for their solution is very important. For this, first of all, it is necessary to keeping their health records. Regular and routine health checkup is very much necessary, either from their own initiative or if it is that they are unable to do it, then it is the responsibility of their children to do it for them. In this age group, people are needed to give, that is the nutritious healthy diet and light exercises. We always advise their family members to accompany this elderly age group either in the dinner table or some time to spare for them, having some talk with them, making them updated, or to go with them in some morning or the evening walk. That will give the refreshness in not only to these elderly people, walking with them, with give some refreshment to these to their accompanying family members also. It is very important for these elderly people to keeping communication with their neighbors, friends, relatives, either by the telephone or over mail. But it is always obvious that elderly age group people, they don't like or don't prefer for this virtual communication. They always prefer for the face-to-face communication. It is necessary for us to invest in the insurance policy, health policy for our parents to keep them stress free and so that they will feel protected. One very important issue for especially the current day context, that elderly people are not too tech savvy and sometimes they are very much unable or feel difficulty to understand the high technology gadgets, and they feel confused on handling them. It is also very important to protect them from rushing into any financial deal where they can lose their money. These things are very commonly reported nowadays.
So, are there any initiatives taken from the Government of India for those peoples?
Yes, from government as well as from the state and some organizations, there are so many initiatives. From Government of India, there is the National Policy on Older Person. This is running since 1999. Under this, there are the provision for the financial security, shelter, health care, protection from the abuse and exploitation. Those all help in their improvement of the quality of life. There is Maintenance and Welfare of the Parents and the Senior Citizens Act, that was enacted in 2007. Under this act, there is the provision for the protection of the life and property of the elderly people. And under section 125 of this act, there is guarantee that if the parents are unable to maintain their lifestyle, or that is the then it is the responsibility of their children to give monthly maintenance for them. And this is irrespective of whether they are staying with their parents or not. In 2010, the first case was filed under this act. This was done by one very elderly couple. Father was aged 84 and mother was 80. They were thrown out by their only son and daughter-in-law from their houses. And so they filed the case. And since then, number of cases have been filed under this act. Besides this, there is the National Program for Healthcare of Elderly. It has started rolling on in 2008-9. Under this national program, there are the health clinic, geriatric health clinic at all the levels, starting from the primary healthcare centers, where there are the provisions of the laboratory investigations, dispensing of the drugs, besides the routine assessment of the blood pressure, blood sugar monitoring, weight checkup, eye checkup, these things. There are the provisions for the rehabilitation and physiotherapy and counseling. There are the provisions for the different aids like the walking aid, hearing aid, then spectacles. These are given free of cost. And there are the domiciliary visits. Home visits are conducted by our healthcare workers, especially for the bedridden or the home confined elderly. During these visits, they take care of the elderly people, whether their medicines are given properly or not, whether they require any specific care or provision of the aids, and as well as along with them, they give the counseling of the family members, educating them how to take care of these people. These are the few initiatives from the Government of India. And so we can say that the elderly people are our asset. We have to love them, care for them, and help them to live their lives with health and dignity.
Thank you so much, ma'am. Thank you so much for this beautiful conversation with us. Thank you so much, ma'am, for everything.
Thank you.